Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them faster than you can call 911. This video explores the Coxsackieviruses, pathogens that can trigger rashes, and may even involve the brain or heart. Have a go at these questions before we start. Which viral manifestation is marked by sudden fever, small ulcers on the back of the throat, and painful swallowing or choking? Which viral complication features enlarged heart chambers that may lead to heart failure? Let's jump in. Coxsackieviruses are picornaviruses, like polio. They're small, hardy viruses with a non-enveloped, icosahedral capsid, which helps them survive outside the body and resist detergents. They carry a positive sense single-stranded RNA genome, meaning their genetic material can be directly used to make viral proteins once inside a host cell. Unlike negative sense RNA, the lack of an envelope also makes them acid stable, allowing them to survive the acidic environment of the stomach. Coxsackievirus A uses capsid proteins, especially VP1, to bind host cells and primarily destroys cells in the skin and body linings. Coxsackievirus B also uses capsid proteins for entry but shows a stronger affinity for deeper organs like the myocardium, pancreas, and central nervous system. Both viruses spread through the fecal-oral route, respiratory droplets, and contaminated surfaces. CVA commonly affects infants, young children, and those in daycare settings. CVB more often affects infants and neonates, especially those who are immunocompromised. CVA has an incubation period of 3 to 6 days. It then manifests as sudden fever and small blisters or sores on the skin and inside the mouth. Common illnesses include febrile rash syndromes, such as hand, foot, and mouth disease, and Herpangina, a condition marked by painful ulcers at the back of the throat. Symptoms of CVA infections are usually mild and self-limited, resolving in about 7 days. Complications are uncommon but may include dehydration from painful oral lesions, and rarely, aseptic meningitis or non-bacterial inflammation of the brain covering. CVB also has an incubation period of 3 to 6 days. Then a febrile illness follows, which may start involving internal organs within days. Clinical manifestations include Pleurodynia, or painful, cramp-like chest muscle spasms. Myocarditis, or inflammation of the heart muscle causing chest pain and weakened pumping. Pericarditis, or inflammation of the heart's lining, contributing to chest pain. And aseptic meningitis. While many CVB cases are mild, complications can occur in high-risk patients, such as newborns and the immunocompromised. Myocarditis can cause dilated cardiomyopathy when the heart is stretched thin and cannot pump blood efficiently. Other CVB complications include pancreatitis and neonatal systemic infection, a condition that may present with poor feeding, extreme sleepiness, breathing problems, vomiting, jaundice, or seizures. In the newborn, CVA has no established association with cancer, but lab studies show that CVB can speed up pancreatic cancer growth. Most Coxsackievirus infections can be diagnosed based only on history and physical exam. Polymerase chain reaction is reserved for severe or unusual cases, with specimens taken from throat swabs, stool, vesical fluid, or blood. Cerebrospinal fluid may also be tested when CVB is suspected. Treatment is mainly supportive, including fluids, fever control, and pain relief. Severe cases, such as CVB-associated myocarditis, may require intensive care. Prevention relies on good hand hygiene, surface disinfection, and isolation during outbreaks, which applies to both virus types. Let's go back to these questions. Which viral manifestation is marked by sudden fever, small ulcers on the back of the throat, and painful swallowing or choking? Answer: Herpangina. Which viral complication features enlarged heart chambers that may lead to heart failure? Answer: dilated cardiomyopathy. Both spot on. You're a titan. If you found this clip useful, You can help us grow by clicking like, share, and subscribe. Scan the summary table in the description. Thanks for watching. Stay aboard Medin 5 for fresh 5-minute med lessons.